I was diagnosed with Moyamoya in March of 2013 after suffering 2 strokes. I had no idea what this disease was or that I even had it. I received treatment 2 weeks after my 2nd stroke, and here I am today. Today I will tell you about the history, diagnosis, and treatment of Moyamoya disease. As described by the National Institute of Neurological Disorders and Strokes, Moyamoya disease is a rare progressive disease caused by blocked arteries at the base of the brain. Moyamoya was first discovered in Japan, where it received its name. Moyamoya means puff of smoke in Japanese. According to the Boston Children's Hospital, this disease receives its name from the appearance of new blood vessels that emerge in the brain. It is not clear when Moyamoya was discovered, but research began in the late 1950s. Moyamoya has been discovered to cause strokes and TIAs due to the lack of blood to the brain. Moyamoya can affect any gender or race, but historically, the Asian population has the highest percentage of people diagnosed with this disease. Although strokes are associated with people of an older age, children with Moyamoya can suffer some of the side effects such as strokes. Since its discovery, research on Moyamoya has steadily increased, but it is still not commonly known. According to the Stanford Moyamoya Research Center, there is research being done to determine the exact cause of this disease. Now that I have told you about the history of Moyamoya, I will now inform you about the diagnosis of this disease. There are a few medical tests that can be used to diagnose Moyamoya. The most common test practiced to discover this disease is the cerebral angiogram. The angiogram releases dye into the brain and is used by doctors to view the blocked arteries. Often, Moyamoya is not diagnosed until the patient suffers a stroke or a TIA. There are, however, other symptoms of this disease, such as migraines, that can lead patients to be tested. Research has not shown that Moyamoya is a genetic disease, but siblings and other family members of patients are sometimes diagnosed as well. The Stanford Moyamoya Center, however, does not recommend family members of patients to get diagnosed to get tested unless they are suffering from symptoms. Even once patients are diagnosed, it is important for them to continue to get tested. This helps keep track of the disease and its progression. Now that I have told you about the diagnosis of Moyamoya, I will now inform you about the treatment. As of right now, surgery is the only viable method to treat Moyamoya. There are 2 surgical options that can be taken: direct bypass or indirect bypass. Both of these surgeries are implemented to restore blood flow to the brain and prevent any more damage to the patient. Most surgeries are successful and although Moyamoya is not curable, most surgeries are successful and prevent further strokes and other side effects. Moyamoya is a progressive disease. Without treatment, it can be fatal. The surgical procedures bypass the blocked arteries and create a new supply of blood for the affected parts of the brain. This surgery is done by sewing a new artery directly into the brain and increase blood circulation. Based on the patient's need, medication may also be recommended for them. Aspirin is usually recommended to thin out the blood and make it easier for blood to circulate through the arteries. Medication, however, is not the solution, but rather an extra precaution. Today I have told you about the history, diagnosis, and treatment of Moyamoya disease. I am a survivor of Moyamoya disease, a disease that is not well known. The moral of the story is that knowledge is power and it can save people's lives.